a miserable failure. That denial was in full display at our last hearing when Ranking Member Blumenthal stated, quote, "I don't know of anybody who's been harmed by Obamacare," unquote. It was an incredible statement considering his own witness, a mom from Madison, Wisconsin, was a victim of Obamacare. Her family lost their employer-sponsored insurance in 2016 because of Obamacare. They purchased a higher tier plan for $1,000 a month in 2019. When they couldn't afford that, they switched to a less expensive lower tier plan with a $14,000 out-of-pocket maximum. By the way, prior to Obamacare, that plan would have been called a catastrophic coverage, and those plans were dirt cheap. Medical bills not covered by their lower tier plan then forced them to borrow $18,000 through home equity line of credit. I would hardly consider that family's experience a smashing success. Our first two witnesses today are also victims of Obamacare, whose stories will hopefully help open the eyes of our ranking member and his Democrat colleagues who refuse to acknowledge reality. Christopher Briggs' story of his daughter with leukemia exposes President Obama's repeated assurance that if you like your health plan, you can keep it, as the big whopping lie that it was. Nick Staley's story of his severely autistic son will demonstrate how Medicaid expansion has harmed disabled children. Our third witness, Joel White, will detail the financial magnitude of the consolidation that has occurred throughout health care since the implementation of Obamacare and how that has weakened competition and led to higher prices. He will describe the root causes related to government regulation of the market that disempowers consumers from choosing the coverage and care that best meets their needs, including price controls and premium manipulation. Finally, he will discuss the principle of increasing competition through consumerism and by reversing the consolidation that has occurred. Our fourth witness, Taryn Bragdon, will discuss the massive fraud recently uncovered in Minnesota and an eye-opening GAO report, as well as define the problems created by Medicaid expansion. He will focus on the 9-to-1 match that has limited access of traditional Medicaid recipients' access to health services, created and perpetuated multiple financing scams, and incentivized states and healthcare providers to structure their budgets relying on those scams. He will discuss the principles of work requirements, equal funding treatment, and the need for effective controls to ensure only eligible citizens receive benefits. This hearing will demonstrate the key principle that must guide successful healthcare reform is re-injecting consumerism and free market competition into healthcare. Obamacare took us in the opposite direction and failed to reduce healthcare costs as a result. Data show patients pay approximately 10 cents of every dollar spent on healthcare. No one, and I mean no one, other than the accountants and clerks, knows what healthcare services and products cost. Not doctors, not nurses, not the patients. The U.S. spent 17.2% of GDP on healthcare in 2024 versus the other top 10 OECD countries averaging 11.3%. A 2019 JAMA paper estimated that at least 25% of U.S. healthcare spending is administrative, waste, errors, overcharging, and fraud. That would not be possible in a consumer-driven competitive market. It just wouldn't happen. The failure of Obamacare demonstrates that the federal government is probably the worst consumer of all. Instead of lowering costs and improving quality and service, Obamacare simply throws trillions of dollars at a failed system, hoping to mask its failures. The Democrats' stated denial will make it impossible to repair the damage done by Obamacare and transition to a system that works on a bipartisan basis. So Republicans will have to figure out a way to do it on our own. The purpose of this hearing is to lay out the next steps that need to be taken in the problem-solving process, accurately defining the problem and establishing the principles that should guide the development of solutions. Having competed in the private sector for more than 30 years, I can testify that free market competition guarantees three basic things: the best possible quality, the highest level of customer service, and the lowest possible cost and price. Isn't that what we want in healthcare? If we do, free market competition is the primary principle we must strive for and adhere to. That will turn it over to our ranking member.
Thank you, Mr. Chairman. If today's hearing sounds familiar or repetitive, that's because it is. It is repetitive of the last hearing we held, and the chairman's opening statement repeats a lot of what has been the Republican mantra. I was inclined to say diatribe, but essentially to repeal the ACA. It has been the Republican mission since the passage of the ACA, and we have voted on it some 70 or more times. Fortunately, every time defeating the repeal effort. And I want to make very clear, our healthcare system costs too much. It has problems like fraud. It is far from perfect. So the chairman saying that I implied that there are no problems with our healthcare system, I think somewhat misstates what I've said in the past. Anybody consuming healthcare knows how expensive it is. But more important than what I say here is what the reality is for American families right now in their small businesses, like Dan Jacobs, in their farms, like Aaron Lehman, in their kitchen tables, their living rooms, where they are going to buy health care right now, health care coverage, and they are confronting double and triple rates, and they are climbing. It is sticker shock that is deadly. People will die. People will die if they can't afford health insurance. So far more important than what I say here is what the United States Senate does tomorrow. The question is whether it will extend the health care tax credits that have made insurance affordable for millions and millions of Americans, including small businesses, farmers, and others. Across the country, more than 20 million Americans are facing an average premium increase of 114%. That's doubling as a result of the loss of these subsidies. In both my home state of Connecticut and the chairman's state of Wisconsin, where Mr. Dan Jacobs is from, a family of four earning $66,000 per year and hoping to hang on to some benchmark plan they have right now will see their premiums more than triple. That's just one example. I could go through a variety of others. I've done it before in hearings that we've had here and speeches that we've made on the floor. But tomorrow is decision day. And we can talk all we want about defining the problem and concocting solutions, and I agree we ought to look at reforms to make the Affordable Care Act better and cut the costs of health care and insurance. But let's extend the health care subsidies so we can save millions of Americans the awful fate of going without health care insurance. We don't have the luxury of time. We don't have the leisure to delay. And I believe that we should recognize how the Affordable Care Act serves our small businesses, our farmers, our individual people, millions of them, who will go without health insurance if we decide wrongly tomorrow. I am particularly thankful to Dan Jacobs, a chef and small business owner from Wisconsin, and Aaron Lehman, a farmer from Iowa, who have agreed to testify today to share their stories. They are just two of the millions of Americans who rely on the Affordable Care Act and whose health care insurance premiums are about to skyrocketing or have already sent sticker shock throughout the American public. There's no question that we need to crack down on the brokers engaging in fraudulent behavior and take action to constrain healthcare costs. But let's resolve to come together to do the right thing for the American people and extend these healthcare subsidies. Thank you, Mr. Chairman.
Hey, Mr. Ranking Member, just real quick, did you say a family of four making $60-some thousand? What was the figure you used?
family of four earning $66,000 will see their costs triple.
Okay, so again, I've just got to point out things that are completely incorrect. A family of four making $66,000 is between 200 and 225% of the poverty line. So they will qualify under normal Obamacare subsidies, probably about a 7%. So they'll have to pay 7% of their income before they get a subsidy. Under the enhanced premium, they had to pay about 3%. But again, that was a temporary COVID subsidy, so they're not losing their subsidies. It's just going from above 3% of their income to now they're going to have to pay 7% of their income for health care. So under no scenario, you can't do math where that family is going to have double or tripling of premiums. This just doesn't happen unless the overall gross premium is doubling and tripling, and nationally it's going about 26%. So again, I'll ask the ranking member in questions for the record to give me the detail on that, but I just have to point out to the people watching this, what he said is just completely wrong, completely false, and
Well, I beg to differ,
we just need
Mr.
to point that
Chairman.
out.
Unfortunately, I wish I were wrong.
You're not, so
And,
provided we'll put it in the record, and I'm happy to.
I will be happy to put it in the record. These numbers come from the Center on Budget and Policy Priorities. The current payment of that family is $1,450, and it will rise to $4,570 a month without the subsidy. $1,450 to $4,570
Per month. Family of four. Family of four.
Family
Again,
of four.
I was buying health care
So you
prior to
can say
Obamacare.
all
It's not
you
even,
want,
not
but
even
the
close to what
family,
premiums were back
the
then.
family knows
So
what is happening.
again, I'll try and get
I'm
this
sorry,
detail.
that is per year.
We'll try and get this squared away. Pursuant to,
Was that just make sure we noted the correction. So is that a dollar amount per year or per month?
Per year.
Because that does make a big, that 12
Yeah,
times difference.
I'm sorry, I misspoke when I said per month. It's per year.
okay, pursuant to Rules 8C of the Rules of Procedure of the Committee of Homeland Security and Governmental Affairs, the ranking member and I approve of Senator Slotkin participating in today's hearing. It is the tradition of this committee to swear in witnesses, so if you all rise, raise your hand. Do you swear the testimony you give before the subcommittee will be the truth, the whole truth, and nothing but the truth, so help you God? Thank you. Our first witness is Mr. Christopher Briggs. He is the Publications and Public Affairs Counsel at the Independent Institute. He received his Bachelor's of Arts in History and English from Bowdoin College and holds a Master of Arts in Political Theory from Catholic University. Mr. Briggs.
Sorry. Chairman Johnson, Ranking Member Blumenthal, and members of the U.S. Permanent Subcommittee on Investigations, please allow me to thank you for the opportunity to testify before you today about the harm Obamacare inflicts on the American people. And I just have to say, this is the first time I've had a chance to sit in front of the Senate. If no harm has ever come to anybody under Obamacare, and it's such a great plan, why are you all not on it? In November 2015, my wife got the most dreadful call a parent can get. The doctor knew why our youngest daughter, Colette, hadn't been feeling well. Blood work had revealed leukemia. So we raced Colette to Inova Fairfax Hospital, the only one in Northern Virginia that treats pediatric cancer, and got there just in time. Now, thanks to Obamacare, we were already in difficult straits regarding health care. Before the ACA went into effect, the market had offered us a wide variety of relatively inexpensive plans that covered specialist care, even out of state. After the ACA, however, all that was left were increasingly costly plans with fewer benefits, including fewer doctors and fewer hospitals. Thanks to the ACA, we were basically restricted to the medical facilities within a short distance of our zip code. The healthcare experts among us will talk about narrow networks. That doesn't even begin to describe the horror. Obamacare made us into medical serfs. We are tied to the land, unable to leave it, even to save a little girl battling cancer, which is why when we tried to take our daughter Colette to Johns Hopkins up the road in Baltimore, we were denied. Under our pre-ACA plan, which didn't geofence sick children from the care that they deserve, she would have been admitted. Now, our predicament was made even more painful by swelling premiums and skyrocketing deductible and maximum out-of-pocket expenses. Pre-ACA, our monthly premiums were about $800 per month, and the maximum back-end expenses was about $3,500, give or take. After the ACA went into effect, our monthly premiums, and this is with subsidies, went to nearly $2,000 per month. Annual deductible and maximum out-of-pocket expenses with subsidies, $20,000 a month, or nearly. And thanks to cancer, which my daughter came down with, we hit those maximums many, many times. So think about that. In the 10 years since the Democrats inflicted Obama's health care plan on us, we had to pay for many, many years, almost $50,000 annually in insurance payments and medical bills. And that was money we did not have. No middle-class family can endure that kind of expense. The upshot of our decade of affordable health care under Obamacare, our savings are gone. And we have virtually nothing left to retire on. And to handle the remaining debt, we are beginning the process of taking out a home equity loan. And this is the subsidized affordability that the Democrats today insist Congress perpetuate. Now, in those dark early days of cancer, when my daughter was first diagnosed, things got much worse than expensive. In 2018, Obamacare literally offered us no plan in our zip code for any amount of money that we could buy that covered Colette's treatment at the one pediatric cancer ward in Northern Virginia, in Nova Fairfax. So under Obamacare in 2018, our daughter was effectively without coverage for cancer, not a common cold or a broken bone, but cancer. What kind of health care plan did the Democrats inflict on us that it can't handle childhood cancer? And we went through another terrifying event in 2020. Now, with COVID sweeping the country in mid-March, the plan we had that year announced that in 2 weeks, it would no longer cover my daughter's clinic, where she received a lot of her chemotherapy. So once again, thanks to the ACA, we were left without coverage for our daughter recovering from cancer. Now, in both cases, we had to appeal to the author of our problems, to the government, to all of you. And fortunately, I was able to persuade, threaten the Senator Warner's staff to bully, in both cases, an insurance giant back into the marketplace. Now, perhaps to solve the instability inherent in Obamacare, the government could just take over all medical facilities, but then everybody in the country would be at the mercy of the same government bureaucracy that has been brutalizing my daughter and her parents for years. Under single payer, we would have not the circumstantial cancellation of coverage that comes with the socialization of insurance products, but we would have dying in line waiting for care, such as they have in UK or closer to home at the Veterans Administration. In those institutions, the scarcity that we experienced is no longer circumstantial, but deliberately meted out to patients as lethal policy. We watched as the institutions of medicine under Obamacare colluded with a disease against our daughter, and that would be a daily occurrence under single payer for every American who's under it. Now, there's one more harm that Obamacare is inflicting on millions of Americans, and this one is quite hidden, but it is massive in scale. Obamacare is not insurance, but a scheme, some would say, I would say, a Ponzi scheme to pay for medical bills. And since my daughter got very sick under a non-insurance regime, she is now permanently uninsurable. And why is that? It is impossible to buy car insurance after an accident. My daughter has had that accident, and she is permanently uninsurable as a result. So if we ever restore real insurance to this country, and we're going to have to, because what we have now is unstable and will collapse on its own. And single payer is a disaster. My daughter will never be able to have one of those plans. Now, if I had been allowed to keep my pre-ACA plan, as President Obama promised, my daughter today and forever, for the rest of her life, would have ensured durable access to medical care. So in essence, Obamacare turned an insurable illness, even one as grave as cancer, into a permanent pre-existing condition from which my daughter will never escape. But my daughter is not alone. Millions of persons have gotten seriously sick under Obamacare, and more will do so every year. In other words, Obamacare is creating right now a nation of pre-existing conditions. Now, many say they're being helped by Democrat health care, including, no doubt, many at this table will say so later. But as the Democrats help you, because they're helping you, they are harming you permanently for the rest of your life. If any of us ever get sick under Obamacare, you have a pre-existing condition for the rest of your life. So my firm recommendation is that if you are on Obamacare now, get out while you can. And I'm asking that this body and the House and the President provide us a way out. There's one correct long-term answer, and that's repeal Obamacare and replace it, not with another planned economy in health insurance, or God forbid, a planned economy in medicine itself. The idea of a plan is the problem. What plan created the iPhone? We should sell insurance the same way. We need to repeal Obamacare and then set up not single payer, but as my colleague at the Independent Institute, who's our president, Graham Walker, has said, what we need is single market across state lines in which millions of Americans can buy real, actuarially sound, automatically renewable insurance products curated to individual needs.
Okay, thank you, Mr. Briggs. We do need to move on. Our next witness is Mr. Nick Staley. He is Vice President of Communications at the Foundation for Government Accountability. He holds a Bachelor of Arts in Political Science from the University of Arkansas at Little Rock. Mr. Staley.
Thank you. Chairman Johnson, Ranking Member Blumenthal, and members of the committee, thank you for hosting this important hearing. I'm Nick Staley, Vice President of Communications at the Foundation for Government Accountability. But today, I'm here as a dad. My family and I have experienced the shortfalls of the Medicaid program as it currently exists on a deeply personal level. Now more than ever, the Medicaid program desperately needs reform to promote work over welfare, protect the truly needy, and root out waste, fraud, and abuse. Medicaid's ballooning enrollment has left the most vulnerable behind. Across the nation, more than 700,000 individuals, most of whom have intellectual or developmental disabilities, are stuck on Medicaid waiting lists for needed home and community-based services. The average wait for these services can last nearly 16 years in some states. As you might imagine, many don't have that long. Remember, every dollar that goes to an able-bodied adult on Medicaid who can and should be working is a dollar that doesn't go to the people the program was intended to help. These aren't just numbers on a sheet of paper. These are real people, including kids with intellectual or developmental disabilities. Real people like my 17-year-old son, Luke, who unfortunately wasn't able to make it here today, but I think you'll be able to see him on the screen. There he is. And I'm sure he'll be able to watch the video later. Luke has severe autism and epilepsy. And though he probably had his first seizures in the womb, the first seizure we saw was at just 7 weeks. I held my tiny newborn son as he seized. It took my wife, Leanne, and me taking him to multiple hospitals before someone finally believed us. Turns out 7-week-old babies don't have seizures very often. It's always serious. 16 years later, we finally learned why. A rare gene mutation linked to profound intellectual disability and intractable epilepsy. Luke is a sweet and happy young man. He enjoys video games, Star Wars, hunting for diamonds with his grandparents at Crater of Diamonds State Park in Arkansas, and fiercely loves his siblings, Peter, Joel, and Isabel. A couple of years ago, we sought out help through a home and community-based services waiver so that he can get the critical Medicaid services he needs to be a part of the community, and so that he can receive in-home care when my wife and I can't be there. At the time, we were told the average wait for someone like him was 11 years. He becomes an adult in 35 days. At this point, we don't know when he'll ever move off that wait list. It's easy to talk about Medicaid reform. It's another thing entirely to live it. I see firsthand how able-bodied adults, 62% of whom don't work, are siphoning away resources that can and should go to fund services for the most vulnerable. These groups move to the front of the line while kids like Luke wait years for services they urgently need. It's not easy to talk about these things in front of the whole world. It's quite painful. And the truth of the matter is that our family is going to be okay. Luke has 2 parents who adore him. He has 3 siblings who love him as well. And he has grandparents who live nearby, and they're there to help him at the drop of a hat. He's cared for, he's loved, and he's safe. So why am I here? It's because my family's story is not unique. It's the story of people in our community and thousands of others across the country who don't have the voice or the resources, financial, family, or otherwise. Imagine being a single mom to a son with autism and epilepsy. You're working hard, trying to keep a roof over your head, and you're told, as we were, that help is coming in 11 years. This kind of help may be the only thing keeping your child from being institutionalized, but waiver services are out of reach. Meanwhile, your state is spending hundreds of millions of dollars on able-bodied adults who move to the front of the line ahead of your child. Does that sound right? Reform is not a choice, it is a moral imperative. Choosing not to act puts the truly needy last while taxpayers foot the bill for an ever-growing program that no longer meets its mission. Now is the time to set Medicaid on a sustainable track and one that protects the individuals it was intended to serve rather than sending them to the back of the line. I'm grateful for this committee's work. I'm grateful for Senator Johnson's commitment to refocus resources on those who need them most. And there's a lot of work to be done, and the truly needy cannot afford to wait. Thank you.
Hey, Mr. Staley. Our next witness is true. It's a repeat witness. But again, the first hearing was about assessing the damage done so we could actually take the first step in solving a problem, which was admitting we have one. We admit we've got one. The other side, not so much. This is all about defining the problem and laying out the principles for solving it. So that's why I've asked Mr. Joel White come back. He's the president of the Council for Affordable Health Coverage. For over 2 decades, he has worked to advance numerous healthcare reforms and has led various issue campaigns to lower healthcare costs and promote healthcare transparency. He holds a Bachelor of Science from American University. Mr. White.
Thank you, Chairman Johnson, Ranking Member Blumenthal, members of the subcommittee. My name is Joel White. I lead the Council for Affordable Health Coverage. These are sad stories about people who have been harmed by Obamacare. I will tell you about the people who have benefited from Obamacare. It is big insurance and big health care. The problem is that America's healthcare system is becoming unaffordable for families, for small businesses, and taxpayers, not because of inflation, but because of policy choices this body has made that have distorted competition, restricted choice, and created a system that rewards insurers when costs rise. Now, I think we all know the results of the law. Premiums have doubled. Deductibles often exceed $5,000 a year or more. Plans limit access to doctors and drugs. And fraud is rampant, over $20 billion annually in the program. At the center of the problem is how the ACA reshaped the market. Washington first defined a narrow set of expensive insurance products that consumers can only use their subsidies to buy, and costs are masked for those subsidized individuals, and subsidies rise automatically as premiums go up. This design eliminated consumer choice and shifted power to big insurers and government bureaucrats. Without meaningful competition, insurers adapted to maximize revenue, not patient value. Just one example, the medical loss ratio. Those rules were supposed to limit profits, but insurers exploited it as a loophole to drive up costs. These rules require insurers to spend 80 or 85 cents of every dollar collected in premiums on medical costs. But by vertically integrating, buying physician groups, pharmacies, and pharmacy benefit managers, insurers discovered that they could run premium dollars through their own subsidiaries and count those internal transfers as medical spending. In fact, 4 of the 5 largest PBMs are now owned by insurance companies, and the top 3 process 80% of all prescription claims in America. Once those claims are routed to entities that they own, insurers can increase spending, satisfy ACA's medical loss ratio rules, and book profits in their subsidiaries, all while premiums rise and patients face fewer options. As competition collapsed in the individual and small group markets, insurer profits in the ACA soared. That jump wasn't driven by efficiency. It was driven by higher premiums, rising enrollment, and expanding federal subsidies. When subsidies go up, insurer margins go up. and you can see it reflected directly in their gross margins and their stock prices. For example, average health insurer stock prices are up 1,000% since the ACA was enacted in 2010, and 450% since plans came online in 2013. This is because the ACA routes massive taxpayer subsidies straight to insurers, not consumers. This year alone, taxpayers will spend about $143 billion, send that to health plans through these subsidies, and about $1.3 trillion over the next 10 years. The fundamental problem is simple. The ACA shifted the market's center of gravity away from consumers and towards large health insurers and health systems. It accelerated consolidation, muted price signals, and rewarded higher spending and fraud instead of lower costs. Layering more subsidies into this broken structure will do more harm than good. To fix this, we must restore the principles that make markets work. First, we should establish system-wide price transparency. This is foundational to competition, lower costs, and higher value. Second, we should empower consumers. Patients should control their health care, not insurers or government bureaucrats. Subsidies should flow to people, not companies, and consumers should be allowed to choose the plan that best fits their needs. Third, we need to restore real choice. Families and small businesses need competing plans and providers, not a narrow set of dictated by Washington insurance designs. These principles will not just lower premiums, they will rebuild a system where the interests of consumers and taxpayers come first. Thank you. I look forward to answering your questions.
Thank you, Mr. White. Mr. Terry Bragdon also is a repeat witness because he's an expert on this subject. Plus, he's got firsthand experience in terms of Maine, how they actually handled pre-existing conditions using the high-risk pools, probably better than anybody in the country. And I certainly wanted to bring him back there to describe how ObamaCare does not cover pre-existing conditions perfectly, not at all. So we'll discuss that later. But Mr. Terry Bragdon is the President and Chief Executive Officer at the Foundation for Government Accountability, which he founded in 2011 to advance free market principles. He previously served in the Maine House of Representatives from 1996 to 2000. He holds a Bachelor of Science in Computer Science from the University of Maine and Master of Science in Business from Husson University. Probably got that wrong last time. Mr. Bragdon.
Chairman Johnson, Ranking Member Blumenthal, and members of the committee, thank you for this opportunity. 15 years after it was signed into law, ObamaCare has not delivered the promise of affordable care that Americans were sold. Instead, what it's produced is skyrocketing premiums, exploding fraud and massive waste, and a system that routinely puts able-bodied adults ahead of the truly needy and leaves many with pre-existing conditions worse off than they were before. The centerpiece of this failure is Medicaid expansion. Medicaid was originally designed for poor children, the elderly, pregnant women, and the disabled. But Medicaid was radically transformed in 2014 under the ACA into an entitlement for working-age, able-bodied adults, most of whom have no dependent children and most of whom are men. Today, 34 million able-bodied adults are enrolled in Medicaid, more than any other group, and federal taxpayers spend more on able-bodied adults than they do on the elderly, the disabled, or children. In the first decade of Medicaid expansion, it cost more than $1 trillion, double the original estimate, while, as you heard, 700,000 Americans with intellectual, developmental, or physical disabilities have languished on waiting lists for basic home and community-based services. In addition, fraud has reached staggering levels. We've all read recently the headlines that reveal billions stolen from Medicaid in Minnesota, and some of that money funneled to terrorist groups. A $233 million Obamacare broker scam, and a GAO sting operation in which every single fake identity that the auditors created was approved for fully subsidized coverage, and 90% were still receiving those benefits a year later, often without any verification of identity, income, or citizenship. GAO also found $21 billion in unreconciled subsidies, tens of thousands of deceased or duplicate Social Security numbers. Health and Human Services confirmed 60% of subsidy recipients misreported their income. 1 out of 5 of every Medicaid dollars is wasted, the vast majority due to eligibility errors supercharged by expansion. The financing is deliberately perverse. The federal government matches $9 for every $1 that a state spends on able-bodied expansion adults, but only about $1.30 for every dollar that state spends on the truly needy. And when states need to cut in times of tough budgets, expansion rolls stay bloated, while children, the elderly, and the disabled are first on the cut list because that's where states can save the most. Obamacare's promise to protect people with pre-existing conditions has also collapsed. Individual market premiums have more than tripled. The average 40-year-old now pays over $7,700 a year before subsidies. Deductibles are more than $6,000, and out-of-pocket maximums exceed $9,000. Those with pre-existing conditions need the best providers. Yet Obamacare insurers use narrow networks, often run by Medicaid managed care companies that exclude most top physicians and nearly all National Cancer Institute-designed cancer centers. Drug formularies and cost sharing are deliberately structured to discourage enrollment of high-cost patients. And the rigid January 1 open enrollment window and the Biden administration's curtailing of short-term plans have stripped away affordable bridges to coverage. State innovation have shown that outside of Obamacare's one-size-fits-none model, there's a better way. In 2011, Maine enacted targeted reinsurance for 8 high-cost pre-existing conditions and modest rating flexibility changes. Premiums with the largest insurer fell 70%, 7-0, in the first year, and enrollment climbed 13%. And that market remained stable even as Obamacare premiums exploded nationwide over the next few years, all the while preserving guaranteed issue and the identical lower premiums and the exact same benefits for people with or without pre-existing conditions. In short, Obamacare is too expensive and very broken. Real reforms have shown that targeted help needs to be focused on the truly needy. We need to provide more healthcare options, not fewer, and full provider access for everyone while eliminating fraud and abuse. I look forward to your questions.
Thank you, Mr. Bragdon. Our next witness is Mr. Dan Jacobs. He's the head chef and co-owner of 2 restaurants located in Milwaukee, Wisconsin. My wife looked up your menu and we've got to try it out sometimes. It looks interesting.
Let's go.
Do you do mushu pork by any chance? That's kind of my...
Not right now, but I mean, for you, let's talk.
We'll talk afterwards. He employs over 60 people. Last year, he was the runner-up on the television series Top Chef. Mr. Jacobs and his wife received health coverage through ACA Marketplace. Mr. Jacobs.
Chairman Johnson, Ranking Member Senator Blumenthal, and distinguished senators, thank you for the opportunity to speak with you today. My name is Dan Jacobs. I am a small business owner from Milwaukee, Wisconsin. I own 2 restaurants, Dan and Esther Ave. They employ dozens of hardworking people who rely on us not only for a paycheck, but for stability, dignity, and a pathway to a sustainable career. I'm here today to express in the clearest possible terms the Affordable Care Act is essential to the survival of small businesses like mine and to the health and security of the people we employ. The ACA leveled a playing field that has long been tilted against small employers. Before its passage, small businesses struggled to compete with large corporations for talent because we couldn't access the same expansive insurance pools or negotiate the same affordable rates. When that happens, workers suffer, families suffer, and small businesses lose the ability to attract and retain the kind of skilled, committed employees who keep our industry strong. In restaurants, our teams are our business. They are the craft, the culture, and the guest experience. That's what restaurants are. To build and maintain a great team, we must be able to offer meaningful benefits, including health care that employees can rely on. Small businesses aren't some niche part of the American economy. They are the American economy. Firms like mine employ 46% of the nation's private sector workforce and create more than 60% of all new jobs. More than 80% of U.S. businesses have fewer than 20 employees, which means the vast majority of employers lack the bargaining power or the scale to weather sudden spikes in healthcare costs. In industries like restaurants, where over 70% of establishments are independently owned and margins are narrow thin, the stability the ACA provides isn't a luxury. It's necessary for survival. Now, everybody else talks about pre-existing conditions. Let's talk about them. Not in theory, but in real life. I live with Kennedy's disease. It's a rare neuromuscular condition similar to ALS. There is no cure, there is no treatment. Before the ACA, this diagnosis would have made me effectively uninsurable in the private market. Insurance companies could and did deny coverage outright or price people like me out of the system entirely. As a business owner, that meant I would have been faced with an impossible choice: risk my health and financial well-being or give up my ability to own and operate a business. The ACA is the reason I can continue to work in my small business, continue to contribute to my community as a small business owner, and continue to employ the dozens of people who rely on me. It ensures that entrepreneurs with chronic or rare conditions still have the right to build something meaningful. It's not an abstract policy issue. It's the reason people like me can remain part of the workforce and part of the economy. Without the ACA, it would become increasingly difficult, if not impossible, for small businesses like mine to compete with larger companies that can offer comprehensive insurance simply because of their size. The ACA doesn't just help us provide health care, it helps us provide opportunity. It gives entrepreneurs the confidence to start new businesses, hire employees, and grow responsibly. It ensures that illnesses don't become a barrier to employment or a reason someone leaves our industry entirely. It creates fairness in a system that too often punishes its smallest players. Senators, I urge you to protect and strengthen the Affordable Care Act. Small businesses like mine depend on it. Our employees and their families depend on it. And the future of a competitive, equitable American workforce depends on it. I depend on it. Thank you for your time. I'm going to end early. Thank you.
Our next witness is Mr. Aaron Lehman. He's a fifth-generation family farmer from Polk County, Iowa, and the president of the Iowa Farmers Union. He also serves on the board of National Farmers Union. Mr. Lehman and his wife receive health coverage through the ACA Marketplace. Mr. Lehman.
Well, good afternoon. It's an honor to be invited to share the story of our family farm and the concerns of thousands of farmers and rural residents across the country. I'm a fifth-generation family farmer from central Iowa, and with my wife, my son, and the rest of my family, we grow corn, soybeans, oats, and hay. And we farm because we love to grow things that feed our community, our state, our country, and the rest of the world. And I also serve as president of the Iowa Farmers Union, which is a grassroots organization dedicated to family farming, sustainable agriculture, and thriving rural communities. Our farmers have been telling us that the Affordable Care Act has been one of the best investments in rural health care in decades. For farming families, entrepreneurs, and employees at small businesses who don't offer health insurance as a benefit, the ACA has expanded coverage, lowered cost, and encouraged farmers and rural residents to take more risk and make more investments on their farms and in their communities. I know this well because my family has benefited from having access to the ACA Marketplace insurance policies and the affordability provided by the enhanced premium tax credits. Because we have affordable coverage, I have a lot of freedom to worry about what our passion is. I'm able to work full-time on the farm where I can concentrate on what's best for our farm, growing crops, maintaining equipment, exploring the best possible market opportunities, implementing new innovations to make us more efficient and to better build our soil health and preserve our resources, and taking smart steps to help our son join the farming operation. When my wife was laid off due to downsizing, she went back to school to get another degree for her line of work. That could not have happened without our access to affordable coverage from the Affordable Care Act Marketplace. Now she works as a passionate care provider and as a physician's assistant conducting in-home health assessments for elderly patients and other patients in need. And she's doing this essential work as a contractor for a company unable to provide health insurance. This position also allows her the flexibility to help out on the farm, during our critical fieldwork times, planting and harvesting. She's only able to do these things because she has the flexibility because we have access to affordable coverage. In fact, she might not have attained any coverage at all if we're not for the Affordable Care Act because of a pre-existing condition. She's a breast cancer survivor. Our affordable health care coverage has been a game changer. But unfortunately, my wife and I have learned that in order to keep a similar policy in 2026, our health insurance costs will more than double. This affordability issue comes at a time when farmers like me are facing enormous challenges. Trade tensions have led to lower prices for what we grow and sell at a time when we have higher costs for all those inputs we purchase. A strained labor market has driven up our costs even further, and USDA cuts have led to increased uncertainty about the programs we depend on. Farmers and farm lenders alike report the increased challenges of financing next year's crop. Farmer concern and mental health hotlines have increased volumes of calls from farmers under serious stress. Without a doubt, a dramatic increase in the 2026 health care premiums for thousands of rural residents will crash individual family budgets and intensify the economic crisis that many farmers are facing across rural America. A stressed rural health care system will feel the pain also. KFF, a leading health policy organization, estimates that 27% of my sector, farmers, ranchers, and other agriculture managers, relied on individual ACA market coverage in 2023. Rural hospitals and clinics, many already operating on narrow margins, will face mounting uncompensated care when residents lose coverage. This will only accelerate the financial strain that has already pushed many rural facilities to reduce service or to close entirely. Our rural economy only grows when people are willing to take risks and make investments. The ACA has provided certainty and affordability in the health insurance marketplace for working people without employer-sponsored health insurance. The success of the ACA has meant that people have been able to start their own businesses, change their jobs, and invest more in their own farming operations. Extending the federal support for lowering the cost of health insurance is a true win for farmers and for all of rural America. Thank you, Chairman Johnson. Thank you, Ranking Member Blumenthal. And thank you, members of the subcommittee.
Thank you, Mr. Lehman. Senator Scott's got to chair a hearing, so I'm going to let him go first in terms of questioning. Senator Scott.
Okay. Thank you, Chairman Johnson. So let's remember when Obamacare was passed. They said you get to keep your doctor, complete lie, keep your plan, complete lie, and you're going to save $2,500 a family, complete lie. So what we've seen since then is the cost of health care has skyrocketed. Instead of saving families $2,500 and saving the government money, it's actually cost the government money and it's cost family monies all across the country. So Obamacare created a system that left many American families with fewer choices, higher costs, and health care that doesn't fit their needs. Every story I hear in my state of people struggling with Obamacare, it's about they can't afford the premiums, they have to put off treatment because it's too expensive, they have to split their pills in half to make them last longer. I grew up in, like a lot of us, I grew up in a poor family. We didn't have health care. We didn't have health care insurance. When my brother had a significant disease, my mom had to find a hospital 4 hours away because nobody back where I lived would take care of him. So I think it's really important that people have access to health care, actually access to health care that they can afford. The system we have today is broken. It's in a crisis. It has not worked under Obamacare. So I've got a bill. I've been talking to the president about my bill and my colleagues. It's called the More Affordable Health Care Act. It fixes Obamacare. It says if you like your Obamacare, you can keep your Obamacare. But my bill is going to actually drive down costs. In the House, Chairman Pfluger of the Republican Study Committee has endorsed it. And so I'm hoping that over time we can bring everybody together to get something done. What this does, it drives the cost of health care down. It makes you a consumer of health care. Think about food stamps for a second. When we want to help people with food stamps, which we do, we don't say, oh, here, I'm going to give it to the grocery store, and they'll decide what food you get. But in healthcare, what we're doing, we give the money directly to insurance companies. They get to make a decision, or government gets to make a decision. I guess if the government and the grocery store chain was making the decision, we'd eat more broccoli. Maybe that'd be good for us. But what mine does is it says we're going to give the money to the consumer. We at one of our lunches, we had a doctor come in that has a surgery center. He charges less than Medicaid, less than Medicare, great outcomes. So people are coming from all over the world to buy healthcare cheaper than what Obamacare pays. But when somebody sets up the system that they make all the rules, then there's no creativity. So the way mine's set up, the state gets opt in or opt out. If you like your Obamacare, if a state likes the way it works, just keep it. But if a state doesn't want to, they can still use healthcare.gov. The state exchange continues. We protect people with pre-existing conditions, because I agree with Mr. Jacobs. You got to make sure you take care of people with pre-existing, and people have to have a safety net. But we add options, transparency. You ought to know what things cost. I just own an urgent care company. I had all the menus up, all the prices up there, just a menu board, just like Starbucks. We ought to be doing that in healthcare. People make good decisions. Mr. Bragdon has talked about that, and people will make good decisions. And President Trump has been right. We ought to stop giving the money to the insurance companies, give the money to the consumer, let them make a good choice. And that's what this does. It says that Trump freedom accounts, and the money will go in there. It can be used for direct health care, can be used for premiums, can be used for co-payments, can be used for deductibles. But what each family could decide what they needed. So we're not going to take health care away. What we're going to do is provide them the option to spend the money better. So it lets people shop across state lines. Like right now, if I want to go buy something, I can buy a product or a service across state lines. Why can't I buy healthcare across state lines? That doesn't make any sense. So I think Americans deserve the ability to act like consumers, just like we do. We have a safety net for food stamps, which we should. Our safety net for healthcare, we ought to let the consumer make these choices. And they're always going to make a better choice. I remember before Part D, I asked my mom and dad when they were on Medicare, how much would it take for you to change the pharmacy? They said less than $1 per prescription. They knew that to the dollar. Today, nobody knows what healthcare costs. Somebody else is paying for it. Nobody's shopping. So, Mr. White, the More Affordable Healthcare Act includes a tax credit for small businesses to provide health insurance to their employers. You run a health coalition that includes small businesses. Can you talk about what's happened with the small group market, and you think this provision will work to increase coverage by small businesses?
100%. It is, your bill meets all the principles that I talked about, and the small business tax credit would go a long way to assisting those small businesses retain their coverage. So basically, since Obamacare was enacted, the small group market has collapsed. It used to be that most small businesses offered their employees coverage. Today, it's about a third. And the exchange, the Obamacare, is made up of about 12 million small business workers. So when the small business dropped their coverage, those people went to Obamacare, where they faced higher premiums, higher deductibles, less access to doctors and drugs. So if you keep people in their small business, if you give an incentive for the small business to offer coverage, they'll get lower premiums, lower deductibles, more access to doctors and drugs. It's pretty simple.
And they get to make their own choice.
And they get to make their own choices.
Mr. Bragdon, the Foundation for Government Accountability has written extensively about shoppable services, price transparency, and the importance of making patients, consumers, bring free market forces into the health insurance marketplace. Tell me what you think about HSAs and directing any insurance subsidy to the patient rather than the large insurance companies.
I think that putting the patient in the driver's seat is transformative. And I'll tell you a story about my oldest son that drives home this point. So my oldest son is on an Obamacare plan. He's an adult now. And he had spine surgery. Only one carrier in Collier County, we live in the same county as Senator Scott, only one insurance carrier had Miami Children's Hospital in network where he received spine surgery. He had a prior authorization that I had to call their national head of government relations to push it through. And then part of his follow-up treatment also had prior authorization to a medical device that cost $3,000, less than his entire deductible. We got approval for that, but the supplier said to us, we know this is going to your son's deductible. If he pays cash, he doesn't have to pay $3,000. We'll sell it to him for $1,500. It's a scam. Literally, it was charging my son for a benefit that was meaningless, prior authorizing something that he could have got for half the price and did, paying cash. So putting money in patients' pockets is transformative.
Thank you. Thank you, Chairman.
Thanks, Senator Scott. Again, the point I've been making is just true. There's not every incentive in our current healthcare financing system is to drive up costs. Everybody's getting a cut of it. And it's like if you're a realtor, I mean, if you're making 7% commission, you'd rather sell that $100,000 house for $1 million rather than for $100,000. And so everybody tries to drive up the cost to $1 million. And that's what's happening across healthcare because of the consolidation. But I'll turn it over to Senator Blumenthal.
Thank you, Mr. Chairman. Thank you all for being here again. Mr. Lehman, you testified that to keep your coverage, you have to pay health insurance premiums that will more than double. Maybe you can tell us how it felt to log on to the ACA and see just how much more you were having to pay.
Thank you, Senator. It's shocking. It makes you think, where can we turn next to tighten our belt when we are already tightening our belt as hard as we possibly can in rural America? Farmers don't have the privilege of passing our costs on to the consumer. We typically are in commodity markets that are highly concentrated, and we don't have much choice about what we get. So being in such a vulnerable position makes you think, what can happen next? So the ACA works for us when we can invest more back in our farm. The ACA works for us when we can think about bringing the next generation back to our farm. And it works for us when we can change jobs freely in rural America. So that's what I was feeling when I was learning about our premium increase.
And what kind of sacrifices will you have to make in order to pay for health insurance now?
Well, like all farmers, I think you look everywhere. You might, for equipment that needs to be repaired or upgraded, you put that off. For soil improvements, you figure out what you can get done in the short term rather than making long-term decisions for your soil health on the farm. You have to start working with your input suppliers, your landlords, and your lenders to try to find terms that you can reasonably put a crop in the ground this spring. Those decisions are very hard, but they're not just one-year decisions. Those decisions have implications long-term for our farm. So that's the concern we have.
Based on your service with the Iowa Farmers Union, are these challenges common to others in Iowa and around the country? And do these premium increases compound the escalating costs that you already face as farmers in today's economy?
Oh, I think it's very, very clear that farmers around the state, farmers all around the country are facing some huge issues that deal with affordability, increased input prices, lower commodity prices. All these things, all those affordability issues even become harder when you're trying to just cover your farmer, your family with affordable coverage.
Let me ask you, Mr. Jacobs, as a small business person, and most especially in a small business that's rooted in your community, you interact with a lot of customers. What kind of premium increases have you and your employees in restaurants that you own and operate been seeing? And are other small businesses facing the same kinds of increased premiums?
I mean, I think you're looking at, are we talking about healthcare premiums, or are we just talking about in general? Healthcare premiums? I mean, we're seeing, I can tell you what I'm seeing for myself. And we're looking at, like, personally for my healthcare plan for next year, it's a almost $6,000 a year or $5,000 a year rate or rise. And that's for the exact same healthcare that I already have. There's no change.
And those additional costs are added to other costs that are also increasing for your business.
Correct. I mean, you look at businesses across the board. We see cost of goods have gone up. You know, we have an American Chinese restaurant. Cost of goods from China right now are not exactly cheap. So I think we're looking, you know, cost of goods, labor, rent. I mean, everything continues to go up. This is just another thing that continues to go up.
And inevitably, some of those costs are passed on to your customers, correct?
Well, the biggest problem here is, yes, we can pass costs on to customers, but if customers are facing the same problems that we're facing as business owners, the first thing that's going to go is going to be outside spending. I mean, spending at restaurants, spending at coffee shops, spending at bars that are predominantly independently owned and are the gateways to communities and how we learn about each other. I mean, food is the way we learn. And it's sad to me to think that, you know, we're going to lose so many independent small restaurants around the country.
You think we will lose small restaurants?
Absolutely, without a doubt. The first thing that people are going to cut out of their spending is going to be going out to eat.
And how about other small businesses? Do you think they'll be affected as well?
I mean, I think all small...
Extend the healthcare tax credit.
I mean, I think you're looking at all small businesses. Like retail is the same thing. My wife has a small retail shop, and I think, you know, you're going to see, you know, just the people just aren't going to be spending that kind of money.
Mr. Lehman, thinking back to when your wife was diagnosed with breast cancer, what would have happened if she'd been forced to wait a year for enrolling in coverage, and what kind of expenses would your family have faced?
Yeah, it's a really good question, Senator. We feel very grateful that her situation was identified early, and we were able to take quick action because we had affordable coverage. And that left us with a lot of peace of mind in a very stressful time in our family's life. So that is so important and something we value so much about the care she received.
Mr. Jacobs, you've spoken about the pharmaceuticals that you take as a result of your symptoms of the disease that you have, Kennedy's disease. How does the ACA plan you're enrolled in make these medicines more affordable for you?
So the most I pay for any of my monthly prescriptions is $15. And without that, even generics would, you know, even the basic generics would be 6 times that. You know, and I'm just guessing because I haven't had a chance to actually, I haven't had health insurance without Kennedy's disease. So, but I mean, the maximum I pay right now is $15 a prescription. And I have 5 different prescriptions.
Thank you very much. I appreciate your being here. I apologize to the panel that I may have to leave early. I have a Veterans Affairs Committee hearing that coincides with this one, so apologies if I have to leave early. Thank you, Mr. Chairman.
Thank you, Senator Blumenthal. So again, the purpose of this hearing is to define the problem, okay? So, Mr. Jacobs, Mr. Lehman, you both realize that the enhanced subsidies, that was something Democrats passed. It was supposed to be temporary for COVID, correct? And it was Democrats that set them to expire at the end of this year. Mr. Jacobs, do you realize that? Mr. Lehman, do you realize that?
I see the reality in the website when I try to sign up for a new policy. We're facing huge increases.
What's going away are the temporary COVID enhanced subsidies that the Democrats set to expire the end of 2025 because the pandemic's over. The vast majority of people on these changes, they don't lose subsidies. They just go back to the original Obamacare subsidy rates. There is a small group, and I think, Mr. Lehman, you may be part of this group, that makes over 4% of the poverty line. They never got subsidies under the original Obamacare. That got subsidies with the enhanced. Those are the people whose premiums are doubling and tripling. Those people I want to help, truthfully. I mean, government caused these premiums to skyrocket. You know, we're part of government. Maybe we ought to do something to help people while we start fixing a horribly broken system. But I want to use both of your own experiences here. We'll start with you, Mr. Jacobs. You've got a gold plan. Again, this is with interviews with our staff.
Yep.
This year, you've got a gold plan. You paid $14,529, and you didn't qualify for any subsidy whatsoever because your income level
It's too high.
is high enough, right?
Yeah.
Again, for a person of two, not to have a qualified, again, I won't press you in terms of what your income is, but it's definitely over 400%. So next year, you're going to be paying $19,000. Okay? That's not because the enhanced subsidies you didn't qualify yourself. That's because Obamacare is causing the rates of insurance to go from $14,500 to $19,000. So the very plan that you're saying is you need it. It's Obamacare's faulty design that is driving premiums, causing them to skyrocket.
I'm not complaining about my lack of subsidies. I'm here because I think it's important that my team members still have those subsidies.
So we can talk about that. I started a small business in 1979. I'm older than you, so I have the experience of actually wasn't perfect, but it worked a whole lot better than Obamacare. And the reason I ran in 2010 is I knew Obamacare would literally not work. It'd be destructive, and it has been. 1979, I started a small business. You know, we had a dozen employees. We had group coverage. I bought just about every kind of insurance. I changed insurance every year. I had the freedom to do that. We went from maybe $100 deductible to somebody came in and said, we'll sell you the same insurance, no deductibles, first dollar coverage. Then they raised our rates 40% the next year. We went to self-funded with specific and aggregate coverage with a third-party administrator. I bought it all. It wasn't perfect, but it worked a whole lot better, and I was able to provide insurance for my company. Now, I did notice in the interview you said, or I think this is actually in an article, you're paying about $7,000 a month for your roughly 75 employees?
Something like that, yeah.
To help them, which is great. I mean, so you're deferring.
I'm trying to, yeah, I mean, we're trying to do what we can.
So you do the math on that. So as an employer, you're kicking in about $100 per month per employee. That turns out to be about 62.5 cents per hour. And I appreciate you doing that. 2013, I was providing $505.50 per hour for health care because I didn't have the Affordable Care Act to offload my employees into awful coverage. I had to compete, and I had to compete with a small business. I could buy insurance, but that was before the Obamacare. So again, Obamacare is the problem here. It's screwing things up for you. You need to open up your eyes on that. Mr. Lehman, so last year, you did get a subsidy, correct? This year, you're not getting a subsidy, which would imply that you're above 400% of poverty line. So with the enhanced subsidies, there was no income limit. So you had to pay up to 8.5% of your wage then you got a subsidy above that, correct?
I'm not sure those exact figures, Senator. I'd have to dig through a little bit here.
That's what the enhanced subsidies did. It capped off. It made people pay at least 8.5% of their income for premiums. Then you got subsidy after that. So this year, you don't get a subsidy because you're over 400% of income. So again, the reason your premiums are skyrocketing from your net premium from $6,000 to over $18,000 is because Democrats scheduled that enhanced premium as a temporary subsidy. That's going away. Again, I've got some sympathy for people who are lured into retirement during the pandemic and now are stuck with these Obamacare plans that you're actually lucky. You know, we've got people in Wisconsin, people close to retirement, they don't qualify for Medicare. They're paying $36,000 a year in premium because of Obamacare. You know, when I was buying health care, you had an insurance policy as a $14,000 or $15,000 deductible. That's a catastrophic plan. Those things were dirt cheap. But, you know, people are paying $18,000, $20,000, $25,000. That's because of Obamacare. Why would you want to perpetuate that incredibly failed system other than, I guess, government's providing a lot of subsidies for people. Now, I know people love free federal money from the federal government, which we can't afford, by the way.
Let me illustrate, if I could. Before Obamacare, of course, we have lots of ups and downs in the farm economy, right? And we monitor very closely where we have farm bankruptcies, and we try to find out what's causing them through our university's concern hotline, many sources trying to identify why did people go into bankruptcies. And for so many of those farmers before Obamacare, the reason they went into bankruptcy might not have been because of prices or regulation, although those are serious issues, but they had a catastrophic illness. And it took everything they got just to try to get care in order to keep the farm going, and many times they couldn't, and they had to take bankruptcy because...
Mr. Lehman, what I'm trying to convince you of, there was a far better solution to address that problem than Obamacare. I mean, Mr. Bragdon talked about it with pre-existing conditions. You know, Obamacare does not cover that perfectly. If you don't sign up during the period and you have a pre-existing condition and you start having expenses for that, you can't sign up until the next period. You know, in Maine, you got to sign up immediately, and they cover that stuff. In Wisconsin, again, I'll use the high-risk pool. We would get people, by the way, like yourself, that has a pre-existing condition. We would hire them. You can't ask these questions. You hire them. You go put them on your insurance. They get lasered out. But because a high-risk pool, they would immediately qualify for the high-risk pool. We could structure the plan almost exactly like our own coverage, paid the same premiums. The high-risk pool was funded by everybody who had insurance. It worked beautifully until Obamacare came and blew it all up. And now we've got this awful system that's driven premiums on average 169% increase on the exchanges, state by state, 4.3 times rate of inflation. So again, I'm probably not going to convince you today, but I just want you to actually look at the numbers. And by the way, you know, the ranking member may have been right in terms of that one individual. His net premium might have doubled or tripled. That's because with the enhanced subsidies, probably only having to pay 2% of his income. And when he goes back to Obamacare's original subsidies, and they're not going away. Of the 24 million people, about 6 of those are probably phantom. So, but of the 24 million people, 22 million are going to continue to be subsidized under the original Obamacare plan. If you don't like that, if you think insurance rates are too high, blame Obamacare. Don't blame the fact the enhanced subsidies aren't continuing. But again, people like you who are above 400% that got lured into retirement, facing $36,000, I want to help them. I've actually got a plan, but it doesn't have to cost a couple $100 billion. It costs a couple billion. But we have to start fixing the system because this is unsustainable. Senator Marino.
Thank you, Mr. Chairman. I thought maybe we could use some props so we can keep the conversation on track. So imagine we're going to have this conversation first. This conversation to the ranking member, which I think is what you're voting on tomorrow, is a very narrow conversation. This is about the Biden-Obamacare COVID bonus subsidies. That's the vote tomorrow, correct? We're not voting on Obamacare writ large. We're voting on strictly.
Are you asking me?
Yeah, well, I just want to make sure we're all on the same
I
page.
assume through the chairman.
Okay, through the chairman, yes. Okay. Yes? That's what we're voting on? I just want to make, because it could be very
The vote
confusing when we talk
tomorrow
about.
is on extending the health care tax credit that were adopted in the COVID era.
Yep.
A good idea. I wish we hadn't put a limit on it.
All
in
right,
terms of
so
time.
just to be clear, so we're talking about this. I just want to make sure we level set for everybody here, because look, I'm about solving problems. I'm not going to be somebody who says that we should let people, Americans especially, suffer because of incompetence of politicians. So we're going to talk about just these subsidies, okay? Nothing else, no other conversation. So, Mr. Bragdon, I ask you a question. Are veterans' health care costs going to go down whether we do this or not?
No.
So if you're a veteran and your copay is going up, or your deductible is going up, or your quality of service is going down, are you affected by this?
Not at all.
All right, if you're a union worker, makes great Jeeps in Toledo, Ohio, are you affected by this?
No.
So if your union health plan goes up 15, 20%, your copay goes up, your deductible goes up, if we do something about this, does that help that union worker in Toledo, Ohio?
No.
How about people who used to work for me in my private companies? I started as a small business owner too, Mr. Jacobs. It's really hard. It's really hard. You want to do something in this world that's tough, start a small business. And if I, in my case, went out and through a dealer association got health care for my employees, and those premiums, are they affected by this resolution of this issue?
No.
If I'm on Medicare, am I affected by this?
No.
If I'm in Mr. Steely's case with Luke on Medicaid, is he affected by this?
No.
So you're talking about a very narrow set of Americans that are affected by this. And that's the disappointing part is that the only issue that Democrats want to fix is for probably something that affects 5 or 6 or 7% of Americans. Why don't we, and I asked this to my Democrat colleague, because the rest of the colleagues are not here, why wouldn't we fix it for all Americans? Americans deserve a government that fights for them every single day to deliver them affordable health care, but we're only talking about a very narrow group of incentives. So now let's shift the conversation over here. How do we get affordable health care? Mr. White, who said the following? Premiums will drop, and the average family will see premiums go down by $2,500 a year in 2014.
President Obama.
Is that a lie?
Yes.
Is there a single solitary American? If we asked this intrepid staff to go hunt down an American citizen, would we find an average family whose premiums have gone down in the last 11 years by $2,500 a year?
I can't think of a case, not in the individual market,
It'd
no.
be impossible. Any market, by the way.
Probably any market.
Right, so the ranking member mentioned a family making $66,000 a year. There's no scenario on earth in which they saved $2,500 a year.
No.
Correct? Okay, so that's good. You said something that was interesting, Mr. Wright. You said that ObamaCare has been fantastic for health insurance companies. I want to quantify that. Yeah. Would it surprise you to know that the stock price of United Healthcare in 2015 was $115 a share, and last year it closed at a record high of $611 a share?
Not at all.
So Jacobs, that's pretty good for a business guy, right? I mean, 5 times the value of your business. Let me put that in further numbers. United Healthcare used to be a $108 billion enterprise back in 2015. That's a big company, $100+ billion. Would it surprise you that it's almost a $600 billion company?
Not at all.
Now, those numbers are so outrageously high, it doesn't mean anything. Let me just quantify that for people watching. Ford Motor Company is about a $50 billion company. It's 12 times the size of Ford Motor Company. In fact, it's pretty much every car company with Tesla excluded combined is United Healthcare in 10 years because of Obamacare. Never have we enriched companies the way that Obamacare has enriched healthcare insurance companies at the cost to the American people. And it's a disgrace. So let's go through solutions. Mr. White, are people who enter this country illegally eligible for Medicare, Medicaid, or the Obamacare exchange? They're not, right? They're not eligible, right? They can't go get an Obamacare premium. They can't get a Medicare card, but they can go into our hospitals and get treated at no charge, correct?
Correct.
And when you own a business and you give part of your services for free, is it really free, or do you really charge everybody else?
It gets charged to everyone else.
So 10, 12, 15 million people who enter this country illegally, presumably with a lot less healthy than American citizens, would have massively increased the cost of our health care. Is that true?
By billions and billions of dollars.
Big transfer payment from American citizens to non-Americans. Would transparency make a difference? If you came into one of my dealerships and I didn't tell you what the price of the car was until 60 days after you took delivery, would you do that deal?
No, sir.
Are you sure?
I'm positive.
Okay. Well, do you think transparency matters? I mean, knowing, by the way, how much an MRI is. In fact, you're a pretty good expert, you and Mr. Bragdon. How much is I'm going to play pickleball tomorrow morning, and there's a pretty good odds that I could hurt my knee. I hope not. What would it cost me to get an MRI?
So I just paid cash for an MRI last year in Naples, Florida, and it was about $230.
And if I went to my health care plan that I get from the United States Senate, my deductible, I think, is like 12 grand. what would I pay for that MRI at the hospital? I'd pay the full boat and pay my deductible, right? Which would be how much?
I suspect that they would have negotiated a really good deal for you, probably like $900 or $1,200.
So I paid $1,200. I could have gotten it for $300. I pay it. Now, when will I know? Like I walk in and they say, hey, I'm sorry about your knee. It's going to be $1,200.
Well, they'll ask for your insurance card first, and then that will dictate your price. And then, as you mentioned, you'll get a letter in the mail after the fact telling you what you owe after you've had the service.
Yeah, exactly. I actually did that in my dental plan. I had a root canal, which, by the way, don't recommend you do that as a elective surgery. And I got a bill for $4,600. I almost fell off my chair. Because, again, they billed the insurance company declined it. So for Mr. Jacobs and Mr. Lehman, would association health plans work? Like, would you love to be able to go to Costco or Amazon or Walmart and be able to buy competitive health care where you can empower yourself and your employees and your businesses to shop? Would that make a difference? Would that save money? Yes or no, real quick, because I'm out of time. I'm going to get the
30% premium reduction.
So why don't we do that? Why don't we do association health plans? Solve this problem for everybody. How about PBM reforms? Should we do that? Why don't we do that? Let's make that happen. Let's not shut down the government over this. Let's work together to solve the entire problem. Let's do that. Let's get together. Let's show the American people we're able to govern. Can you imagine if tomorrow morning the American people woke up and go, my God, the leaders in Washington, D.C. are able to govern and solve our problems? Would having most favored nation status for drugs lower the cost of health care, yes or no?
Yes. In fact,
Cross-state shopping, would that help? Reducing administrative costs, would that help? Tort reform, would that help? Putting money in health savings accounts? Why don't we do all these things? Instead, what we do is we do performative outrage and managed failure of votes that we go on and say all kinds of nonsense, knowing there's no chance your bill's passing tomorrow. But do you want it to pass? Or do you just want to have a political issue so you can continue to get reelected? It's disgusting what happens in this town. It's why I ran for office. And I hope we could find it in our hearts to actually solve this problem for the American people. But the lack of seriousness, as displayed by the fact that you called a hearing and not one Democrat other than the ranking member is even here to listen to this testimony. Mr. Jacobs, Mr. Lehman, I empathize with you. I'm a small business owner. Let's solve this problem. Let's make that happen. Thanks, Mr. Chairman.
Thanks, Senator Moreno. By the way, on PBM reform, I'm all for it when we come up with reform that the big pharma is not pushing. There's something wrong there, but haven't quite figured that out. We will start a second round, candidate order, so I'll go first. Do we have the chart? Do we have?
Mr. Chairman, I'm going to have to leave, but I would like to just enter into the record a couple of documents before I leave.
Did you want to ask a couple of questions before?
I have just a very brief explanation.
I'll let you go first.
Okay, thank you. I would like to enter into the record two studies, one of them a KFF analysis, the other is a journal from an article from the Journal of American Medical Association. Essentially, they show that insurance premiums and out-of-pocket health care spending were growing even faster in the years leading up to the ACA than they are today. And so I'd like to put into the record the KFF analysis and the article on out-of-pocket medical expenses from the Journal of the American Medical Association indicating the rise in healthcare prices has slowed, in fact, since the ACA's enactment. And, you know, I might just say, I noticed Senator Moreno is gone. He asked me a bunch of questions, but evidently don't want to hear the answers. Yeah, we can do a lot to improve the healthcare system. And yeah, I'd love to do it. We face a deadline for the ACA healthcare tax credits. And in the homes of Americans, in the small businesses, they have to deal with reality. They can't pay for health care with a speech from United States senators. They need these health care tax subsidies extended. And I note that as much as we've heard about how bad the ACA is, no one has talked about the other bill that we're going to vote on tomorrow, which would provide for health savings accounts as a substitute for extending these subsidies, which do nothing to make health care affordable for people who face Kennedy's disease or cancer and whose expenses are going to go way beyond the $2,000 or some other number of dollars that would be put into these HSAs. So regrettably, we don't have time to overhaul the American healthcare system in the next 2 weeks before Americans face the sticker shock of these rising prices. I thank the chairman for his courtesy in allowing me to enter these articles into the record.
And those be entered without objection. I will say again, what we're talking about the enhanced subsidies, extending those for, we'll call it 22 million of the 24 million. Those people just go to Obamacare's original subsidy schedule. They're not going away. They just go back to the way Obamacare was originally designed. We're talking about 1.6 million people. I got a feeling Mr. Lehman's one of them that maybe got lured into retirement or whatever, but enjoyed a subsidy during the pandemic. It's going away. And yeah, I mean, that's got to be some real sticker shock. And I agree with Senator Marino. I have a great deal of sympathy for you. Mr. Jacobs is completely unaffected by that personally. I understand his business, but he's got high enough income. He doesn't have the subsidy. He doesn't like the $5,000 increase in his premiums, and I agree, but that's not because of the enhanced subsidies going away. That's just because of the awful design of Obamacare driving up these premiums. But we'll enter those things in the record. So enjoy your next hearing. Do we have that thing on the screen, the insurance companies? Okay. Mr. White, this is a chart that I wish I would have used in our last hearing, but this is one right now. I mean, this pretty well confirms what you're talking about. The stock price increase since from March 2010 through November 2025 of the 7 largest health companies pretty well proves your point. You want to comment on this?
Yes, sir. I think if you start looking at the numbers, what's happening here, again, the government created a very expensive product and then said to people like Christopher, well, we'll help you subsidize it. We'll give you a subsidy and we'll pay the insurance company for your access to that plan. And that subsidy increases dollar for dollar when the premium goes up. So the incentive is to increase the premium to get more subsidies. And that's what happened. So when you look at the gross margin per ACA enrollee, I think it's about $1,800 this year. That increased from $60 in 2014. It went straight through the roof as the subsidies increased. And that gets reflected in the stock price. Some of those stock prices are up by 1,500, 1,600, 1,800, 2,000%.
Investors are pretty smart. They're not going to drive up the stock price if their earnings potential isn't growing because of Obamacare. Can you think in the current system? Can you think of any incentive throughout healthcare to actually drive costs down? Can you think, I mean, again, of the players in there, the insurance companies, quite honestly, there should be incentive for government, but as you can see, they just want to throw, a few $100 billion more at a failed system. Is there any incentive?
The insurers are colluding with the hospitals and the other healthcare providers to drive costs up across the board. They make more money when the costs are higher because you've linked subsidies directly to the premiums. So everyone has an interest in colluding to get the costs as high as possible.
Everybody's getting a cut, and you're better off getting a cut of something, again, like a house. You'd rather sell $1 million house than a $100,000 house.
Yeah, correct? It's like getting a commission on $1 million house.
I was on CNBC yesterday morning, and right before me, they had the now retiring CEO of Walmart. And it was a perfect segue into me, because I'm saying the solution here is consumerism. Mr. Jacobs, I mean, you are competing in the marketplace, right? If you could be a monopoly, and if you're a business person, you'd love to be a monopoly, you could have charge a lot higher prices, your customer service wouldn't have to be that good. Your food wouldn't have to taste that good. Just, but because of competition, you have to be really good. You can't afford to charge more than what customers will pay. And these customers are looking at all kinds of different restaurants. Your quality has to be good. People won't show up. And you better have some pretty pleasant waiters and waitresses too. So, okay, that's what a free market system does. That's what we've driven out of healthcare. You've got 10 cents of every dollar spent on healthcare being paid by a patient. The rest is through a third-party payer, either insurance carrier or the government. That's basically it, right? So I hear colleagues say we've got to pass a law for price transparency, and they have. It hasn't worked because, okay, you see it on the you don't care. Because you're going in there and your insurance coverage is going to cover that MRI, and quite honestly, you'd rather have that MRI cost a lot, so you burn through your deductible, so you get into your actual insurance sometimes. So again, there's no incentive to lower costs. And I don't think you can drive competition through a government law. I think the only way to do it is bring consumerism back. And that's why I'll defend the baby step that the Republican alternative will be tomorrow. Again, I would like to have something far more robust, but it's at least moving that direction of bringing consumerism back in. I mean, Mr. Bragdon, would you kind of agree that consumerism is really what we need here?
I think if you don't have consumerism, then nobody has to be responsive to the patient. Right now, healthcare under Obamacare is between the insurance company and the federal government, and the patient's left off to the side. If your denial rate's 35%, like it is with United Healthcare, it doesn't matter because government's still going to shovel money into your big business. If you only have one choice for that specialist you need in network, too bad. You can't go anywhere else. And so if you don't have consumerism, you're left out in the cold, and that's what's happening to millions of Americans.
So again, I really wanted you to talk about, because I don't think we, in our last hearing or in this debate, talked about it enough, the 9-to-1 match. And in particular, talk about how that has driven scams, things like provider taxes, provider fees. It's not health care. It's driving up what the federal government has to spend, but it's also doing something pretty nasty about incentivizing providers to focus more on those able-bodied adults at the expense of a severely autistic child. But to talk about that, first of all, but then also just talk about, because of that, how hospitals, how states have literally structured their budgets around that, which is why we couldn't really fix that in the one big beautiful bill. I mean, there was just too many constituencies, too many states, Republican states, they were hammering on their Republican senators going, hey, we need that 9-to-1 9-to-1 match. We need those scam dollars flowing out of the federal government.
So I think a great example of this is in Arkansas, using the story of Mr. Staley's son. So in Arkansas, the state share for kids with disabilities is the state has to put up about 30 cents, and then the federal government will match 70 cents. But for able-bodied expansion adults, the state puts up 10 cents, and the federal government matches it 9 cents. So Mr. Staley's son is on a waiting list. 90 cents, sorry. 90 cents. So Mr. Staley's son is on a waiting list for 11 years, but it costs the same total cost to the taxpayer for 2 able-bodied adults as 1 severely disabled child. So that 1 severely disabled child waits 11 years, but the same taxpayer costs, the 2 able-bodied adults go to the front of the line every time. It's incredibly perverse.
Isn't part of the problem, too, is particularly the Biden administration allowed those providers to charge commercial rates for Medicaid patients. So we're paying, what, double and triple sometime versus even Medicare rates? I mean, just talk about that dynamic.
Absolutely. Under the scheme called state-directed payments, you could have politically favored providers that got permission from the state and federal government to charge exorbitant rates, far above commercial rates, far above Medicare rates. And so what that effectively said was to that provider is it's better for you to treat a Medicaid patient than it is to treat an elderly person on Medicare, or sometimes than even to treat somebody with commercial insurance. So again, the federal government's picking winners and losers, but Medicaid expansion under Obamacare has made everyone else a loser, including the truly needy.
So, Mr. Staley, when did you first really discover this perverse incentive. I'd imagine you kind of signed up for home health care and you just probably were somewhat, why can't we get on it? I mean, when did this kind of dawn on you, what Medicaid expansion was doing and how it impacted your son and your family?
Sure. Yeah, so when we first expanded Medicaid in Arkansas, I called my state senator and I said, I want to know that when you guys do this, you're not going to do anything to harm these truly needy populations. And at the time, I didn't know anything about it. I'd never worked on healthcare policy. And so all I wanted to know about was the TEFRA waiver program, which is just basic Medicaid services. And my state senator said, don't worry, we got that covered. You're going to be fine. Well, that part was fine. But what I didn't know at the time, and what I didn't really know until some number of years shortly before we applied for waiver, was that the waiting list had grown and that there were folks who had been on it as long as 13 years in our state. And in fact, there was one case of a young woman named Skylar who had a traumatic brain injury that resulted in neurological damage, and she spent almost her entire life on that waiting list, very nearly died on it, passed away when she was 18 years old, sadly. But we see this time and time again where people are literally dying on those waiting lists.
Are the single adults on the waiting list?
They
or
are
they
not.
get put in the front of the line?
They go to the front of the line.
So able-bodied adults go to the front of the line as disabled children wait, languish without those services for a decade or more.
That's accurate.
So, Ms. Briggs, I want to delve a little bit more in terms of what you had. When was your daughter diagnosed with leukemia?
November of 2015.
Of when?
2015.
2015. So this was already, Obamacare's in place. What kind of insurance did you have before Obamacare?
Yeah, so when I jumped out of my corporate job and decided to set up my consulting firm, we did a lot of searching in the pre-ACA marketplace to make sure that I could afford to take care of my family as I did this. And what we found was a tremendous number of plans available. So many, in fact, I had to bring in consultants to tell me what would be best for my family. And we settled on a plan that charged us maybe $800 a month in premiums. And the maximum out-of-pocket deductible was maybe $3,500 for the family. And that, as I said in my testimony, that just, I remember when this law was passed, and I turned to my wife and I said, they're going to socialize the insurance products market. This thing is going to explode. Like, there's no way we're going to keep our doctor. It's no way it's going to say it. And, within a matter of weeks in 2014, when it went into effect.
By the way, do you remember what were you paying for that? You said $800.
Yeah, $800 and then about $3,500 on the back end. And then with Obamacare, it went to almost $2,000 right away. This is before cancer.
Per month.
And the back end was about $17,000. I mean, it was really high. Fortunately, we didn't have that because we didn't have cancer in the house. When the cancer hit my daughter, things just went totally crazy. And then, as I said, twice.
Prior to that, you didn't have a real narrow network. You had.
Oh yeah, no. So we were able to we had, our other children who needed to go to Johns Hopkins, we went to Mayo Clinic. We could go almost anywhere.
So.
And afterwards, no way. We couldn't go anywhere.
Again, over my 30 years, you started getting in-network, out-of-network. I mean, again, the thing was definitely evolving. I'm not saying that the whole thing was perfect, but you could always go out-of-network. Now, you had a higher deductible or higher out-of-pocket maximum, but you could go. Did you have that option with Obamacare?
Absolutely not. No. Well,
you couldn't even go outside a network and pay more. You were just denied using that.
Right. So Johns Hopkins said no. And we thought, well, maybe we'll go to CHOP, Children's Hospital in Philadelphia. And they said no. We even tried at one point because we knew we were going to get less care than we wanted. We thought, well, let's move to Texas. No state income tax, and MD Anderson is there, and Texas Children's Hospital. Maybe we can do that. And what we found out is that there wasn't a single Obamacare plan to buy that covered pediatric cancer care at MD Anderson or Texas Children's Hospital. And that is the same way, that is pretty much to this day. Yeah.
And I think it was Mr. Bragdon, you talked about that Obamacare is famous for, squeezing out or not allowing cancer centers into networks, which I actually find pretty shocking. I didn't realize that.
No, absolutely. And so when you think about providing access to people who need it most, like his daughter, you have the best quality providers shut out of network. In my written testimony, I cite an example where 97% of local doctors are out of network in some Chicago Obamacare plans.
It's not covered. Senator Slotkin.
Thank you, and thanks to our witnesses. Hopefully, if I'm here, that means you're at the end of your time here. It's almost over, and we're at the end of the dais. I wanted to ask a little bit, Mr. Lehman. You know, I understand you're a farmer, you're a fellow Midwesterner. I'm from Michigan, I understand that you depend on the ACA or Obamacare. 25% of farmers across the country depend on it because they don't have, employer-provided insurance. And I also understand that your wife dealt with breast cancer.
Yes.
And I'm glad to hear she got past that. My mother had breast cancer when I was a young child. And I think the thing that people miss with the ACA and the fundamental thing that it did, and no one would say it was perfect. I don't know a single person who thinks that it's perfect. It's a Band-Aid on a broken system. But it required coverage for people with pre-existing conditions.
That's right.
From my own family, my mom had that cancer, breast cancer, double mastectomy and a lymphectomy at 31 years old. So when she didn't have employer-provided insurance and needed to go on the marketplace before Obamacare, they could just charge her whatever they wanted because she happened to have had this cancer. So my brother and I were in school. We didn't know. She went 5.5 years with no insurance, and then ultimately walked into an ER years later and was diagnosed with stage 4 ovarian cancer. And I think about what kind of preventive care, a doctor saying, hey, you had breast cancer really young, you should get genetic testing or have a hysterectomy. So these are real issues that affect real people in real ways. And again, Obamacare is far from perfect, but that guarantee that they can't gouge you because of what you happen to be born with or have, I think was a fundamental thing that I think most Americans believe in today. I understand that your plan, you have gotten notice that your plan is going to go up precipitously here.
Yes.
Can you tell us about what's about to happen? I mean, we're in December, January 1, this all changes. And then I want to just ask you how it affects, like, you get notice of this bill. How is it changing your own thinking about your own life and what you can and cannot do?
Yeah, we, as best as we can tell, in order to get a similar plan that we had in 2025, the cost for us to have that same plan in 2026 is going to more than double. Mm-hmm. That is an incredible cost for our family budget, for our farm budget. Farmers right now are trying to make all sorts of decisions because commodity prices are low, because of chaotic trade situation that we're in, higher input prices. We've experienced USDA services that have been curtailed at our local level and other places. All these things have made a real crisis for a lot of our farmers. So finding ways to deal with that, we just don't have too many options. Farmers will buy less equipment or not make the necessary upgrades in equipment that they need to. They'll look at their input suppliers and they'll decide what can we do to get through just this year, even though that means long-term soil health issues on our farm. It means negotiating with landlords and with bankers to try to find the best terms to deal with all of this, just to get a plan to put the crop in the ground.
Yeah, and I think, farmers I'm on the Ag Committee, farmers are under incredible stress. We have a big, bailout package that's now being approved, and you don't bail out farmers when things are going right? It's a problem. I would note that Michigan farmers, we do specialty crops. We're not like Iowa, and we are excluded from that deal. So our farmers are really, small and medium-sized farmers are really suffering. I understand you're 5th generation or 4th generation farmer. What does it mean, for your kid? I mean, your family. Yeah. Are they thinking about farming? And how does healthcare, since you're not going to get employer-provided insurance if you're a farmer, how does that factor into a decision to have the next generation on the farm?
Well, not just for my family. I'm lucky enough that my son is taking steps and helping out on the farm a lot at the 6th generation on our farm. You have to be very smart to figure out the plan that can bring the next generation on the farm. And I'm not alone. I'm about I'm 57 years old, 58 years old, and that is, 57 is the average age of the Iowa farmer. We desperately need young and beginning farmers to come back to the ground. And we have a lot of innovative, driven, smart folks who want to farm. Making this investment so that there can be some security for young farmers taking that risk to come to their farm, whether it's to feed their community or through local and regional foods, or whether it's to grow commodities on their family operation. That's an investment worth making. And that's where these making affordable health care available to that generation makes all the difference, whether you can encourage that next generation to come back to the farm.
Yeah, I think, we obviously have a big vote this week, and obviously it's a point of contention between Democrats and Republicans, but I've never seen an issue like healthcare where I don't know a single person who thinks it's going right? Patient, doctor, pharmacist, nurse, admin, assistant, every single person feels like we're paying too much for our healthcare. And it's screaming out for just some real significant change. And again, Obamacare was a Band-Aid on an open wound of millions and millions of people not having care. And I think it helped a lot of people get care, but it's not the long-term plan. And in another time, if Washington was healthy and we were engaging with each other, we would say, it doesn't matter what state we're from. Democrats and Republicans are hearing, on both sides of this dais, are hearing it is not working for people. And instead of just kind of what we'd say at the Pentagon, admiring the problem and talking about the problem from every different angle, would actually just lock ourselves in a room, kick out the media and Twitter and whatever, and just figure out how we do healthcare in a way that is worthy of the country that we all represent. So I'm ready to do that with anybody. I mean, literally anyone who wants to work on that. But in the meantime, I'm not going to take the Band-Aid away and say to people, yeah, sure, go ahead, just double your price of healthcare next year. So thank you for being here. Thank you to all the witnesses. I hope in another time we can actually, have a conversation, not admiring the problem of healthcare and talking about how bad it is, because it's bad, but actually doing our jobs up here and figuring out a solution. So thank you for your time, everybody. Appreciate it. Yield back.
So Senator Slotkin, first of all, thanks for attending the hearing, for requesting to be on it. The title of this hearing is to define the problem and the principles used to solve it, okay? Just so you're aware, in terms of your witnesses here, both are above 400% of the poverty line. Mr. Jacobs never got an enhanced subsidy. His premium is going up from $14,500 to $19,000. Again, not because we're not extending the subsidies, because of the underlying problem of how the exchange premiums are skyrocketing. Mr. Lehman did get a subsidy last year. He won't get one this year because he's above 400%. I completely agree. These premiums are being caused by the faulty design of Obamacare. That's being caused by government. People who got lured into retirement, and that's not exactly Mr. Lehman's case, but a lot of people were during the pandemic. They, retire, we're going to help you with your health care. The rug's being pulled out from under. I'm happy to work with that, but it's not 340 million people. It's not even 24 million people on the exchange. It's about 1.6 million people. And I'm more than willing, I've actually got a plan, got it scored, of providing subsidies for those people over 400. But here's my question for you, Mr. Lehman. What percent of your income do you think you ought to be required to pay for health insurance before a subsidy would kick in? I'll just, to help you out a little bit, the enhanced subsidies allowed for you only had to pay 8.5%. The Obamacare's original design was 9.5%. So that's the way Obamacare is. So if you're at 400%, under the enhanced subsidies, you had to pay 8.5%, then you got a subsidy. Under the original design, again, most of those people in the exchange, they're going to just go back to the original Obamacare design at 9.5%. So what would be a fair rate for people who, under Obamacare, never was going to get a subsidy? 400% people, okay, you got to fend for yourself. what percent of your income do you think you and your wife ought to pay before you get a subsidy from the American taxpayer?
Senator Johnson, it's a good question. Like a lot of farms, ours is complicated. Our situation is complicated. My wife, when she got laid off, decided to go back to school so that she could provide care to people in their homes. Now, we agreed to take on some student debt because of that, because we knew that there would be the benefits of being employed and serving people in that regard. So it's a little bit complicated when you bring in all these factors about student loans.
First of all, everybody's got a situation, but again,
Yes, I agree. Everybody
in terms of
does.
policy making, when Obamacare did it, they said, okay, above 400%, we're not going to subsidize you. 400% or below, it's going to be 9.5%. So again, you got to simplify this stuff. So I'm going, if you're above 400%, never we're going to get a subsidy. I want to help you folks out transition when we can actually hopefully fix the problem here. And I'd love to do it in good faith. We need 60 votes in the Senate. What would be the percentage? I just need something in mind. What do you think would be a fair percentage for you and your wife to pay of your income? I know it's not that easy. It's probably as complicated as you can get with a farm. And by the way, I've got my parents grew up on farms. My relatives. I mean, I realize there's a great book, by the way, Land Rich, Cash Poor by Brian Reisinger. Read that. It's depressing. It's just showing how many families. So listen, I'm completely sympathetic that way. But again, I'm just looking for kind of a ballpark percentage. What do you think?
I don't have an exact figure for you, Senator. And I know that these issues are very, very complicated. We know that there are real issues in concentration in our rural areas, whether it's fertilizer or meatpacking or our healthcare system. And we do need to work on those things in order to create more fairness for our farmers out there. But my conversation tomorrow is with a healthcare advisor who's going to help me choose what is the best plan for us and our farm, what's most economic for my farm. And I'm afraid that conversation is going to be pretty simple. And I won't be able to get into all the other issues about why I'm here. I got to figure out how to pay for this thing.
Again, all I'm trying to convince you of is the reason premiums are so sky high is just I can describe it to a certain extent. Prior to Obamacare, we had things like high-risk pools, the caring for, and by the way, pre-existing conditions, they weren't covered perfectly, but they aren't covered perfectly under Obamacare. We talked about that earlier. In Wisconsin, you had to wait 6 months. You could buy insurance for everything else, but that condition was exempted until you had a 6-month waiting period, then it picked it up, okay? But, so again, it wasn't imperfect, but so was Obamacare. So that gets kind of lost in the conversation here. But everybody had insurance. Every insurance plan kicked in a little percentage to fund that. And in Maine, they did it better. It's a better system. They just took 8 different conditions, and you got put into, and you got your care paid for, but it was spread over everybody. Obamacare had the very small percentage of Americans, and prior to the pandemic, it was 10, 12 million Americans on the exchanges. That small group of Americans were forced to pay the cost of people with pre-existing conditions. Guaranteed issue. It was an enormous cost. It caused these premiums to skyrocket. Plus, when government is your customer, you can charge them just about anything. And that's what's happening. So again, it's just, I know I'm probably not going to convince you. If I do, let us know. Announce it to the media. We have to repair the damage done by Obamacare, transition to a system that actually works, that does put consumers in charge. That's what we have to go do. There's no government program, there's no government law you can pass that is going to force transparency and going to make people actually bring down their prices, improve their quality and service. That's what consumers do. That's Adam Smith, the wealth of nations. That's what a free market system does. Obamacare is not that. But anyway, I will ask Mr. Jacobs, what do you think would be a fair percentage? Keep it at 9.5%? Oh, I guess we're not closing this thing out.
I am not a policymaker. I couldn't.
But you're a business guy.
I'm a business guy, sure, but I'm also a chef. It's not necessarily we're not necessarily the smartest men in the room all the time.
Again, Obamacare topped it up. They said you have to pay 9.5% at your 400% poverty line. So Obamacare said you have to pay 9.5% of your salary So if you're above 400%, never contemplated to get a subsidy on Obamacare, if we decide to give you a subsidy, what do you think?
I think I'm also the wrong person to ask this question, or you to ask this question to me, because I'm going to be, I would rather pay more so people who make less could have better health care.
Okay.
I'm the wrong person to ask that question to.
Okay. Senator Hawley, thanks for coming.
Yeah, absolutely.
Floor is yours.
Thank you. Oh, dangerous thing to say. Thank you, Mr. Chairman. And thanks for waiting for me. I'm just coming from another briefing.
I didn't. I just kept droning on.
Well, it worked to my advantage. I'll be brief. I know the panel's been here for a long time, and I'll give each of you some questions for the record. But I just want to ask you, Mr. White, nice to see you again. I think I saw you recently in another hearing, and you've gotten the question I'm about to give to the panel. But let me just ask you this. Here's an idea to lower healthcare costs. What do you think about exempting healthcare spending, consumer spending, from taxes? What if we just said no taxes on healthcare spending? Your premiums, tax-free. Your deductible, tax-free. Your out-of-pocket expenses, tax-free. We already have, as I think Mr. White pointed out in a hearing recently, we have in place an approximation of this. If you itemize as an individual, if you itemize your taxes and you spend more than 7.5% of your adjusted gross income on out-of-pocket expenses, you can deduct everything above 7.5% if you itemize. Of course, businesses, big corporations get to deduct all of their spending. So why not allow individuals to deduct everything, first dollar, make it tax-free? What do you think? Let's just go down the panel, and then I'll give you questions for the record. Go ahead, Mr. Lehman. Do you want to pay less? Do you want to pay less taxes on your health care? That's the question. Who's going to say yes to that? But maybe somebody will. Go ahead.
I'm afraid I do not have the expertgoing of the tax code in front of me to give you a really good answer on that. Thank you.
Okay, Mr. Jacobs.
I'm going to follow this gentleman right here. I'm not that guy. I'm not the guy to ask this question to.
Mr. Reagan.
Senator Hawley, I think it's a great idea because then you're providing fairness to everyone. Whether I pay out of pocket or a premium or have some alternative, you're treating it the same. And government should be fair. It shouldn't pick winners and losers. Great idea.
Now, Mr. White, you said actually the other day, and I thought this was a great point, taxes make everything more expensive. So if you want to reduce costs, why not lower taxes, in this case on health care, which are exorbitant. But go ahead. I'll let you fill in or not.
My answer hasn't changed. Great idea. We should do it.
Great. Mr. Steele.
Senator, I have 4 kids, so I'm in favor of lower taxes.
Yeah, very good. Mr. Briggs.
Would have made a big difference in my life if that had happened.
Yeah. All right. Well, thank you all for being here. Thank you for your testimony and your expertise. Like I said, I'll have some questions for the record, but I'm sure you're eager to catch your breath. Thank you for waiting for
Senator Hawley's going to give those 4 $20. You want to take a shot at getting $20 from Senator Hawley for just by saying yes, it's a great idea? Apparently not. I think with that, there's more ways to skin a cat here, right? I do think Republicans have a lot of good ideas on how to do this. The question is, how do you implement it? How do you implement it where you have Obamacare structure still there? When you start bleeding people off of Obamacare, that's going to make it even worse for those exchanges. You kind of got to start from the ground up, truthfully. But also understand we're really talking about a pretty narrow percentage of the American public on the exchanges, which has kind of screwed so many things up. It's, how do you bust up some of these oligopolies, truthfully? I mean, we got to figure out antitrust. They've consolidated. We need to restore competition. Again, that's my main point. The main principle, you need competitive markets. You need consumers worried about how much they're paying for things. And I think Senator Scott mentioned that surgeon in Oklahoma. Cash on the barrel had his rates for surgery were 10% of what hospitals are charging. I mean, that's remarkable. But that's what's possible out there if we can bring consumers back into this. So again, I appreciate the fact Senator Slotkin wants to work with us. If that's true, happy to do it. But we really do need the other side to admit they have a problem, not say this is the greatest thing since sliced bread. There's no problem here. Just throw hundreds of billions of dollars at it. That's not a solution. It's not certainly something that I can support. But I truly do appreciate all your witnesses. I will give you, if you do it briefly, we'll start with Mr. Briggs. Do you have a final comment that's just burning that you got to get out there?
Yeah, I do actually, and it comes down to this question of fairness. So I was trying to explain to my family a few years ago, why is Dad so exercised about our problem, right? And I said, well, imagine, you go to the grocery store last week and you went and bought your favorite candy bar. Say it's a Snickers bar. and you've been doing this for a while, and last week, like every other time you went there, and it would cost $1.50. Price is right on that thing. You go to the cash register, and you pay for it. It's $1.50. Elon Musk is behind you. He buys a candy bar. It's $1.50. Someone from the lower middle class is $1.50. I said, the way we sell healthcare in this country, at least under Obamacare, is as follows. You go into the grocery store. There are no prices on anything. You take that candy bar to the cash register, and you say, look, there's no prices. What happened? You know, what are you going to charge me for this? And the register, the cash register, the cashier says, show me your tax income, your taxable income, and then I'll tell you how much I'm going to charge you for it. So for me, it's $5. For the guy behind me, it's $1,000. For someone behind me, it's $2. So what we no longer can suffer under anymore is the equity of fair cost. This is what we really need is the equality of real prices. And that's the huge difference. I have no idea how much I'm going to be charged when I bring my cancer-ridden daughter in for any of her treatments, big or small.
Right.
And this is the problem. Equity of fair cost will destroy us. Equality of pricing is the answer.
And having consumers do this, that literally solves the problems. Mr. Staley.
Thank you, Senator. You know, I would just say that every dollar that is spent on an able-bodied adult is a dollar that can't be spent on the truly needy. And so as Congress looks to address this, one of the most important things that has to be looked at is the fact that we have these perverse incentives that were created by Obamacare. And unless that's taken care of, the truly needy will continue to be at the back of the line.
By the way, Senator Scott had a really good proposal. He just caps off enrollment for that 9-to-1 match. States wanted to, bring in able-bodied adults, fine, but you're going to get paid the same amount as you get for a disabled child. Unfortunately, because hospitals and states have based their budget around that, the scam is created by 9-to-1 match. We couldn't get that done, and so we still have that inequity and that perverse incentive where able-bodied adults are at the front of the line rather than the back of the line. Mr. Roy.
This bill that you will vote on tomorrow, the Crapo-Cassidy legislation, is a step in the right direction, and I would blow it out. I would make it massive. It would change significantly the dynamic in play right now where we are empowering insurers over consumers. If you give the money to consumers, you change the dynamic in the market, and you force insurers, doctors, hospitals, everyone else to compete for the money that the consumer controls. If you do that, prices come down, access opens up, people start getting better care. So that would be the biggest change you could make that changes this dynamic, the unsustainable trajectory we're on, where costs are ever increasing, subsidies are just going through the roof, insurers are empowered, and consumers are at the back of the line.
And because that is the solution, the medical establishment cartel, they would hate that. So they're going to do everything they can to lobby against it because the system that we have right now is working beautifully for them. It's just not working so good for the American people. Mr. Bragdon.
I think it's really important to look at what are solutions that help everyone. Right now we're talking about a vote on these COVID credits that really empowers insurers to improve their stock price and to put a bunch of money in the bank, but leaves folks with pre-existing conditions with massive deductibles, massive out-of-pocket limits, and no access to providers who can actually help them. And what we need to focus on is how do we help the truly needy, but how do we have more choice and empowerment of patients so they can get the care they want and need to get healthy?
Mr. Jacobs.
First off, I want to say thank you for having us here. I think this is incredibly important, and I think you're right. I think it is broken. But while you're trying to fix it, don't take away the things that are helping Americans. Don't take away the subsidies.
But again,
I know that you think.
Let me just quickly.
Well, can I?
No, I'll let you.
I thought this was my final.
We're not taking away the subsidies. They're going for the vast majority. For the vast majority of people, those subsidies remain in place from original Obamacare. Now, the enhanced subsidies would go away. You're right, but I mean, don't mislead people.
Right.
All the subsidies are going away.
No.
The vast majority are staying in place. But
right, and I know it's.
I apologize for interrupting, but I think it's important.
Okay, I know that you're talking about a narrow population, but that's still 24 million people. That's a lot of people, and I think those people truly need the help. Thank you.
Well, a huge thank you to the chairperson, the ranking member, and the entire committee for letting us share about our farm and about our communities. And we do want to work together to address concentration and consolidation that really impacts our rural areas. That's an important area for us to continue to work together on. I just want to emphasize that the Affordable Care Act works when I can invest more and my neighbors can invest more of their time and resources on the farm. It works when we can bring the next generation onto the farm. And it works when we can improve and change jobs in rural America freely. So again, that doesn't happen when healthcare is not affordable. So making affordable options for folks is extremely important. A huge thank you to the committee. Thank you, Senator Johnson.
Really appreciate all of you coming here and enjoying the exchange. I mean, this is kind of like not a normal Senate hearing, so appreciate that. I agree with you. We have to make health care more affordable. Obamacare didn't do that. It just didn't do that. Again, 24 million people, 6 of them are probably phantoms. So that's costing us, according to Paragon, about $27 billion per year of fraudulent payments into the insurance companies. That's one of the reasons their stock price is so high. $27 billion. I mean, that's, the people are being prosecuted. This isn't make-believe. So about 4 million, take it away 6, and probably about 18 million on the exchange. 16 million plus will go into the old Obamacare subsidies. You don't like that, complain to Obama. We're talking about 1.6 million people, and I would like to help those people. I wish we could have got that into the Republican alternative here, but I will be working in good faith, already talking to some Democrat senators about working in that. When it's going to fail tomorrow, unfortunately, we know the result. I don't like this place either. But again, truly appreciate it. I hope you enjoyed the hearing, the testimony. The record for this hearing will remain open for 15 days until 5 p.m. on Thursday, December 25th, 2025 for submission of statements and questions for the record. I will say probably nobody will be here on December 25th to take it, so get in there before that. But this hearing is adjourned.
Hãy subscribe cho kênh Ghiền Mì Gõ để không bỏ lỡ Em ơi cái chuối mình lứa